Right, so we've had a local government perspective, we've had a perspective from an august and important broadcaster, we've had perspectives from in the room, but now we want to make sure that the voice of experience of using services and those who use services and those who are involved as relatives is heard in the conversation here today as well. So we have a panel that's going to give us a service user perspective in Macfarlane. Marjory Broughton is going to give us a perspective from a point of view of relatives and also her national work with TLAP. And Stephen Lowe from Age UK is going to give us a policy perspective, I think is what's going to happen there. So it's very, very good that we have this panel, and my job as the chair is to stick to time this time. So we're going to make sure because I'm now keeping you from lunch, so we'll stick very firmly to time. We're going to have 2 or 3 minute sort of nuggets that people want to get across. Then some questions from the floor. Please start thinking about what you might want to put as points, and then we'll have a bit of a discussion. So I'm going to start in the order that we have on the agenda. So I'm going to ask Anne to kick off. Anne.
Thank you. Well, it's good today to be here talking about social care and how important it is to people who use services, and particularly services like Homecare. I've been asked to say what I feel are the sort of 3 priorities. What do the user really want? Well, I haven't used Homecare services for, pre-1988. But I have used them over many years, and of course I know some things have changed. I also listen to people who use home care services. I've got friends who use them and so on, so I know a little bit about home care. The first thing I think that's important is to think about the care plan itself. And what we haven't really done very well in this country, and what we still don't do well, is we co-produce things with the people that actually need the support. You know, we're told we need a care plan, a social worker comes along and works sometimes with you to really go into detail, but you know, they're on time constraints. Terribly important that people have a chance to think about what they really need in a particular setting. And because often people come from places where they've been already looked after in hospital, particularly we're talking about older people, but it happens to younger people too, then it's hard when they're dealing often with a number of staff, they don't know really quite who they are, and then they get transferred back home, and then it's perhaps a bit of rehabilitation, and then it's think what it is you actually want if you're going on to have long-term support. I think it's really important. People want time before the social worker or the care manager comes. They need to be left with a question or 2, preferably something that they can access, not just on a telephone call, might need it in print, in large print, they might need it in a different format. But they need to think about it so that when it comes to the day of the plan, they have got an idea of what they really want and what they could manage perhaps without, or they could perhaps struggle to do themselves and they want to do that. But on the whole, it's about their planning as well as yours. And then they come to the care plan, and that is so good if it can be properly co-produced. So the first priority is somebody who is able to listen. And listen, I mean meaningful listening, not just mindful listening, all those lovely words we hear today. And that really helps because it cements a little bit of that relationship where we hope we might see the same social worker again. I think mine resigned when it came to all the new changes. It was all too much to bear, but she was a very good social worker. So that's the first thing. But in terms of home care, once the care plan is drawn up, we've got this huge culture shift. We are in exciting times because we've got to try and work out how we change from time and task to choice and control. You know, if I don't want a bath today, but I want to go out to the latest auction or whatever, then I'm going to skip it. But it's, yes, yeah, I did have a bath this morning. But you see what I mean? People need sometimes to follow their dreams. They've had a life before you've met them. I've had a life before my social worker turned up for the care plan. And it's important that they know, that they really respect. That's a second priority, really respect. I've been to lots of conferences where I hear the word respect and dignity, but one really needs to unpack those words. A friend of mine on last Tuesday, went to visit her, 2 catheter bags hanging in wherever, which everybody could see as soon as they walked into the house, and an absolutely used sanitary towel sitting on a locker. You don't just want, but you know, that's a really, really good example of terribly poor practice. But then you see the lovely practice, and there's so many good workers out there, and that's my third or second point, is that we must value our staff. I value my staff, and I really want to be able to see things from their perspective, but I still need my care and support. I moved over to direct payments, and so I recruit my staff. I know I've got a job description. I go all through it carefully with them, see if they're prepared to do those tasks. You know, if an older person really is worrying about the nets at the window, and they're not allowed to have them taken down, but that's the thing that's depressing them, then you leave those people in a bad way. But you need to have people to make the choices where they can, and not everybody can make big choices, but everybody can make small choices anyway, like what they like to eat, what clothes they want to put on in the morning. But not just that, it's not just about personal care, it's about understanding what makes a person tick. So it's what they really want. They don't want to be patronised. Language is very, very important because it can make or break you. I tell people about a course I ran for people in a day centre, and every disabled person introduced themselves by their medical condition. We have to make sure we actually know the person, and then we can work well with them. And Paul, I guess that's my 2 minutes plus. So I'll keep quiet. I've got loads I could tell you, but I have to leave it there.
Thank you very much, Anne. At that point, I'm going to take that as the stop for the moment. We'll come back and we'll get some reaction from colleagues in the room as well. So we're moving on now to Marjory, who's going to give the perspective of relatives and carers.
Right. My mother was widowed when she was about 42, and she brought up a pair of adolescents and a younger child. So she was fiercely independent and always determined that she would, do her best for her children. So when she rang us up and told us that she had a terminal diagnosis and had less than 6 months to live, we all had our farewell, went up to Scotland to see her, and she told me that she was born in Scotland and she would die in Scotland, and there was absolutely nothing I could do. She was not willing to come down. So she lasted 7 months, and then she had a cerebral hemorrhage, and she recovered. And because I was able to come up with something quite exciting for her, she lived another 15 years, which just goes to show that when you're in charge of your own destiny, it does something to the medical diagnosis. So in order to do this, I purchased her property and released that capital, and I chose a national provider at that time. This was in 1998, so she died 2 years ago. So it sort of gives you an idea of the time span. And this agency that I chose was a nanny agency that covered care of elderly people as well. And they were wonderful, but they were terribly expensive. And so in the end, I had a combination of the agency, and I employed my own sort of carers who had to live there. And so I could have bought a British Airways jet. I think I used to nip up often at weekends, especially if there was a crisis. So she was always able, she developed it, she had this terrible sense of humour. And she, one of the little things that I noticed she did, she always thanked the carers for doing a little task for her. And so they enjoyed coming into her. And it's a two-way sort of process, this. You know, Barbara, I'm calling her, you know, that's her name. She, as I said, she retained the control over what happened. And if she said, I don't want a bath today, she wouldn't have they would leave her alone. And they were wonderful. Now, I looked for people who enjoyed looking after older people. I took up all the references because they were living sort of en famille with my mother. They would, when the relatives came over, my sister from Vermont and my brother from Canada came over, they sort of fitted in round my mother's sort of process. And I think, you know, she was a self-carer. Now, the fact that she became my friend, not my mother, and you know, those years I wouldn't have, 17 years was 15 and 17. And so I wouldn't have missed that for anything. And that's why I'm involved in the Ageing Society, because it can be good, and there can be wonderful care provided by home care providers. And I just quickly want to one of my colleagues in TLAP, Sally, her mother was dying in a residential care home, and she received a joint, she just, you know, that was it. And Sally has a son with a learning disability, and she approached her local authority and received a jointly funded care package that enabled her to bring her mother home. And again, her mother hasn't died. Her mother is at home, living a very, you know, her friends visit. She's loves her gin and tonics, and you know, all these factors ensure that her mum is cared for. She's at the heart of the care, and that's the secret of good care. And whilst we all recognise that funding can be an issue, there is no reason why, if somebody's receiving funding, they could say, don't do the dusting, sit and talk to me today. So that's what I would recommend that you advise your employees. And finally, I'd just like to say that because I do a bit of work for CQC, I have done an awful lot. I've seen and heard an awful lot of wonderful organisations that provide home care. Some not so wonderful, but I like to celebrate the great home care that we have. Thank you.
Thank you very much, Marjory. Lots of very important points there. And final contributor is Stephen Lowe from Age UK.
Right. Okay, so Age UK has this morning published a report on the state of health and care, in which we it's a statistical report, and we show that since 2005 the number of people who are getting support from social services has reduced from, for a number of older people, has reduced from 480,000 to 360,000. We've previously pointed to the extent of unmet need that results in. Over 1 million older people have difficulty carrying out basic activities of daily living, and aren't getting any help. They're not getting help from social services. They can't afford to purchase their own help. In our report, we break that down a bit. One of the statistics relates to the number of people, older people aged over 65, who can't carry out particular activities of daily living and are getting no help at all. So it's 11% have difficulty getting dressed, 12% have difficulty with bathing, 7% getting out of bed, 4% using the toilet, 3% eating. We also sort of point to the impact of that and the effect on other services. So, for example, over the period 2005 to 6, we've seen an 88% rise amongst older people in urinary tract infections, where you can easily see how that can be linked to the fact that 4% of older people have difficulty using the toilet and aren't getting any support to do so. So I think the first basic point I'd like to make is that there is still a huge need and a huge unmet need for what you might call traditional home care, help with carrying out personal care, basic activities, the physical help that people need. In looking at what people say they want, we carried out a big piece of research earlier this year with the British Gerontological Society, which we published in June, and it's basically a report about the concept of frailty and what people want and need, older people want at different stages as they progress along the route from needing no help to needing a bit of help to needing quite a lot of help to becoming totally dependent. Some of the conclusions from that report probably aren't a surprise. Is what people want is they want to remain independent, they want to go on having a choice about how they live their life, they want to be able to go out, use local social amenities, stay in touch with their family, not be a burden on friends and family. I suppose what I found surprising from the report is that although older people are aware of the fact that they may potentially, their health may deteriorate and they make plans for the future, they're not really aware of, many of them aren't aware of what social services do and what contribution traditional social services can make to their future needs, or how to get social services. So they really tend to see, to think about other solutions than traditional home care. So what we're moving to within Age UK is we have this model of care we call the home care service, which is aimed at people who purchase their own care, and it's the things that people want other than personal care. So that would be things like cleaning and housework, laundry, shopping, both shopping for people and going with them to do shopping, escorting people to go out, paying bills, collecting pensions, minor household jobs, checking people's safety, things like checking sell-by dates of food in the fridge, things that carers would actually do if there's a carer available. And I suppose that what makes me think, and I suppose the assumption Age UKs are basing their developing services on, is that in the future people will be moving away, where they're purchasing their own care, from just purchasing a traditional home care service to wanting a wider package of care. That at the other end of the scale, as local authority social services are more and more concentrated on people with the most high needs, you're increasingly be going to be providing services to people who have multiple long-term care conditions, have dementia. So it's increasingly, or it ought to be, in services that are integrated with NHS provisions. So we've seen both Paul and Ray James talk about the overlap with community nursing services. So I can imagine that we will see that polarisation of home care into actually services for self-funded that aren't just traditional home care, and services that are more targeted at people who primarily have health needs for the statutory authorities are purchasing. But I suppose what my concern would be, what about the big group in the middle who actually need that help carrying out, physical tasks in order to carry out activities of daily living. They're losing out, and I don't see what the solution to that is going to be.
Thank you very much. And a sort of important point about as the sort of market changes to become more added value, more specialist, what happens to a large group of people in the middle. Some really important points about people need to know what the options are, that it should be co-produced, that we're looking for a life, not a service, I think is a point that I take very strongly both from Marjory and from Anne. And the fact that it's reciprocal, that we're not talking about being done to, that actually this is about relationships as well, and that being very important. Now we've got a little bit of time, and it is a little bit of time, for some comments, reflections, questions that people might want to make. And there's a hand gone up over here, and whilst you're asking your question, sir, there's another hand over there as well. Excellent. So we've got two. I'll take two or three, and there's another hand over there. So I'll take those three, and we'll see where we are after that. So.
Okay. In the panel's opinion, what is the solution for loneliness?
Nice and pithy question. I like that. Going back over there.
I'm from the MS Society. Definitely echo what's been said about kind of person-centered care and people wanting that flexibility and not, when the carer comes in to say what they want on that day. People with MS tell us that. But I was wondering, any thoughts on hiring PAs and, having that personal budget, and obviously local authorities have duties to provide information on how to do that, but how are people actually finding those assistants, and what kind of rules are in place or safeguards to make sure those people have the right training and etc. Thanks.
Okay, and there was another person there, yes.
Hello, my name's Anne Buckley, and I run a company called Independent Care, which I started in 1989, February. And we have a longest surviving client who came to us in the July of that year. So we've provided care to him for 26 years now, and it is about listening to him and having a mutual respect, being flexible, and just trying to look at that person's needs, and for listening is so important. So we're quite proud of that, and we were talking the other day about perhaps writing a paper around how that's happened and why it's happened, and that's just to share that and to say that I'm quite proud of that.
And can I really encourage you to do that? I think the point that's been made earlier, that
well, our longest surviving
really
client
important.
is an MBE with services to the health service, so I think he might do a good job.
Excellent. But thank you for telling us about that. Let's get some response on the 2 points. The sort of growth in the provision of PAs, personal assistants, and the use of direct payments to fund those. And the point about the solution to loneliness. And if you get the answer to that today, then you can make maybe a lot of money and certainly build your reputations hugely. So let's see what answers there might be on those. I'm going to start with Anne, perhaps just to pick up on the PA role and your own experience of that, and what you would want to feedback about standards, safeguards, and training.
Thank you. Well, as you heard, I've been using direct payments, and I call them direct payments because we've built up other phrases like personal budgets, personal health budgets, this, that and the other, but they all really mean more or less the same thing. Yes, I have employed quite a number of people over the years since 1988, but I could truly say that I've always had people that have become long-term staff because they have job satisfaction. They know the person well. I don't have to keep repeating myself every single day, which is wonderful. And they know. The PA that helped me this morning, fantastic. I said, look, I've got to be up earlier, a bit earlier than normal. Can you try and come 5 minutes early so that, I can get a little bit of a start? And yes, that's what she did. She knows what the needs are basically, but sometimes I say to her, okay, let's change today and do something a bit different. And of course that keeps people stimulated. It makes them think, I wonder what she's got up her sleeve for me today. Little did she know that at about 7:45 last night, she was wrapping up, this morning rather, she was wrapping up a pack of Pampers. So that was what she was doing. And she said, oh, Anne, that's interesting. Who are they going to? So it is important that those little jobs that help me to maintain a lifestyle are there. Now, I was asked about, recruitment. Well, as an employer, I have to go through all the employment regulations, make sure that I'm employing staff that are entitled to be employed here. I've got a very multicultural staff. Makes life very interesting. That's another thing. They do respect me, and that's great. Also, the best trainer usually, if somebody's fit well enough, and well enough I would say is the important word, then that's the best person to train the people that come to you. All my staff I train, and if I want something done that might require 2 people, or I take on a new person, I get the person that's been working with me for a long time to shadow the person that's coming in. It's not terribly, it's not very exciting. It's the same usual process that everybody else has to go through if they need some help of some kind. But it is important. I have to confess, and this is going to be really, really difficult for you to hear, that I have never done a DBS check on any of my staff. I have never had anything stolen. I've had one or two breakages, but that's an expectation, that's a risk you take when you're moving lots of things around. And I just want to touch on the integration of health and social care, because I do think we've got to work hard to make this work well. And I think it's a huge change. In my authority, we are working on something called a design authority group, and it went live last Monday, I think, for a pilot up until Christmas, where I can't go into all the details, but it's important to know that people are working on these schemes, that they've involved the people that use services quite really well for the first time in a long time. They've really taken on the user voice and the carer voice and the staff voice. And of course, dare I say this, they all came up with what we talked about 30, 40 years back. Isn't that exciting? It's just that now we've got a whole new bureaucratic system coming in. That's the difference. But it's critical that people don't have so many people in their lives. When I had Homecare all those years back, I'd see 40 different people in a month. That wasn't unusual. It has got better. In many cases, people do have more continuity. You must know who's coming into your home. And also, you must take a little bit of interest in their lives as well as your own. If they want to share something, I feel I must make time to listen, because if it's important to them, it's important. And sometimes I finish up being counsellor, I never allow my PAs to sit down with me and have a cup of coffee. I haven't got time, but they can have a cup of coffee, they can drink me out of coffee, but I'm not sitting down and having a chat about the weather. But I want to stress the importance of that. I really do. I think we do have a lot of lonely people in this country, and we call them housebound. Nobody is bound to their homes, physically bound. It's a wrong terminology. We must use really positive terminology to make people feel better about themselves for a start. It's all about the well-being agenda. And
just can I say that in terms of the well-being agenda,
people want lunch.
They will want lunch in the moment. That's important to their well-being. And
you see what I mean? When you get me, you get the full.
Absolutely. When we talked before the session, you told me you had a lot to say, and I said, well, try and weave it into the answers to the questions, and you've done that brilliantly. So I'm going to now get Marjory to pick up on particularly loneliness and approaches to that as well. Thank you.
Right. Well, loneliness. There are sort of various options, but very often there will be community initiatives with volunteers, and they're really good. In my village, and it only happens during snow, and we often get snowed in, in the village. And the parish council says, well, why don't you check if you've got elderly neighbours? Well, if you've already met them, then you don't need to check. You can just pop in and say, have you got, do you need anything? So it's quite easy to encourage volunteers to visit people. It depends on the person, of course. Now, hiring PAs. PAs are absolutely wonderful because I'm part of the National Co-Production Advisory Group, and we have many members who employ PAs, and it has opened up their lives and enabled them to become part of the community. So if you are lucky enough to have a personal health budget or a personal budget and have PAs, then you're less lonely. That's another benefit. But it enables people to play a full part in the community. And the safeguarding, again, I just used to take up references when I was employing people. Always a verbal reference, not a written reference. And I would never tell them when I was going to ring. And that way, I think I got a more honest assessment of this person, and nothing was ever stolen. And by the way, when all this was going on with my mother, we had my mother-in-law who had full-blown dementia living with us. So it was a great fun in the household.
Thank you very much, Marjorie. And finally, Stephen.
Just one point on loneliness, and that's it's actually quite difficult once people become isolated. It's actually quite difficult to get pulled out of that isolation. So it's really important to actually support people at an early stage. So, for example, if people come out of hospital, they have reablement. It's important that reablement isn't just about improving their physical health, but about building their confidence and helping them to link themselves back into the community. I think it's always been the case with Age UK. We've always argued that having walk-in day centres where people can go before they reach the stage where they need social services is hugely beneficial, because people have built up that network that they can then retain when their long-term conditions increase and they are getting social services, and that kind of, I suppose, provision is under threat at the moment.
Can I just add one sentence?
One sentence.
One sentence. The most important thing is that the longer you keep people at home, the greater the savings, and therefore social services and government should invest in that.
I'm really pleased I let that sentence be said. It's a great way to end the panel. I'm not going to sum up at all after that, because I think that's the place to